Choosing between becoming a paramedic and a doctor can be a difficult decision for some people. On the Future Doc program, we've actually got quite a few people who have done both paramedicine and then gone on to do medicine. So in this video, I'm going to tell you some of the stuff that you probably can't Google, and like some of those things that they don't quite tell you, insights that will help you decide which career you might want to go for. It'll cover everything from training to lifestyle to mindset and just a little bit of the realities of each career to help you decide which one is best for you. Usually people come into this decision because they want to save lives but haven't thought about exactly which way is best. Both of those professions overlap, but they are different in terms of their time commitments, their salaries, their personality types, like I said, and the mindset that you have to go into in the different scenarios that are presented to you in both professions. So the paramedic route in the UK is a 3-year BSc degree in paramedic science and then registration with the Healthcare Professionals Council. And with that, you're usually operational, so up and running within 3 years of starting your degree. Medicine, on the other hand, is a 5 to 6 year training degree, plus then 2 years of foundation training working as a very junior doctor before you start your specialty training. So medicine is not only longer, but more academically intense. However, it does offer a wider range of clinical specializations once you get the degree. But the nature of the work can differ. Of course, medicine, the specialty will dictate exactly what your life is like. But for paramedics, it's a lot more on the front line. Paramedics are often first at the scene, whether it's road traffic accidents, arrests, medical emergencies, and they have to make quick split-second decisions with very little information. So they have to be comfortable really operating under uncertainty. And one of the things that paramedics will tell you that maybe you wouldn't read in a book is that it is physically quite demanding. There's a lot of lifting and helping patients. You're often in bad weather conditions, for example, and it's often quite emotionally charged situations that you enter. So that takes its toll in a psychological way as well. But as a paramedic, you are very much at the front of the action, and your level of skill and ability to make decisions will have a big impact on how likely that patient is to have a good outcome. Hospital doctors, on the other hand, work in much more controlled environments, theaters, clinics, wards. Even when I was working in A&E, when the paramedics would deliver a patient to you, they would kind of neatly have wrapped them up, and they'll have done all of the difficult front end stuff so that by the time they have been brought to you, even in A&E, they have been stabilized somewhat. Not always, but most of the time. Now, the thing with doctors is that they usually manage the full case and have the full diagnostic arsenal, so all the tools available for you to get the full picture, whereas paramedics just get that snapshot. They have to work with uncertainty, like I said, and also they kind of get them stable to the point where they send them to hospital. And one of the things that paramedics say if they do transition to medicine is that they do wish that they had more contact over the full case of that patient's journey. However, other paramedics absolutely love the fact that they are doing the kind of most life-saving, immediate intervening stuff to get them out of an extreme situation into a more stable environment where then the medical team can take over from there. The pace does vary for both. Paramedics can have quiet shifts or crazy shifts where they have loads of arrests that they're called to. As a doctor, you might have days where things are a little bit more regimented, but at the same time, doctors might have days which are just jam-packed full of emergencies. So what about the lifestyle and the hours? Well, your typical paramedic who's kind of fresh out of training will be working shift patterns, which often means, long days, nights, and weekends. And during those shifts, call volumes can be unpredictable. I actually do comparisons between different professions and medicine in this entire playlist that you can see up here to get a bit more of a flavor of what doctors' working patterns are like compared to other professions as well. And as you'll see me say in those videos, doctors still work long hours, and especially during their training, it's also shift work and less control. But as you progress, you start to shape your hours a bit more around the specialty that you choose. However, in this particular comparison, both jobs do mean 3 a.m. coffees and sometimes missing birthdays. So what about the career progression and earning potential? Well, paramedics fresh out of training who will be a band 5 typically earn anything from £28,000 to £35,000 a year. But there are also advanced roles for paramedics, such as specialist paramedics or critical care paramedics, and they advance into band 6 and even 7, which has an earning potential of £55,000-ish. There are also opportunities for them to branch out into research or education or even air ambulance, which is really cool and exciting stuff. For doctors, when they're starting as foundation doctors, can earn anything from £32,000 to £37,000 a year. However, if they go all the way up to consultant, it can be anything from £90,000 to £100,000 a year plus, as well as some of the private earnings that they can do to top that up. Specialty and subspecialty training does take longer. However, it does offer a wider variety of work and higher long-term earning. So when it comes to personality, you're probably wondering, well, which one do I suit more? Well, if you are the kind of person that likes quick decision making, fast action, they like to be able to be calm under pressure, they like the pressure of physically challenging and mentally challenging environments that they have to act in quickly, then paramedicine might be for you. However, if you're more inclined for analytical thinking and you want to manage the patient over a longer term and you're not afraid and you have the stamina for a lot of study, then medicine might be a better one for you. To simplify it, I would say that really, if you're drawn to adrenaline, immediate action, operating in uncertainty, then paramedicine may suit you. However, if you enjoy deep diagnostic reasoning and long-term patient relationships, then medicine might be your path. And remember, these two careers aren't mutually exclusive. They share a lot of common pathways. So it's not uncommon for us to see on the Future Doc program that we help paramedics who've got their paramedicine science degree come over to medicine to study. And the transition is actually not always the smoothest because it's not counted as a science degree for some reason, which does mean that graduates usually have to go via the kind of non-science degree route into grad medicine, but it's very much possible. It just means that you have to tailor your application a certain way to make you eligible. Equally, it's not uncommon for doctors to work alongside paramedics in what we call pre-hospital medicine, including everything from HEMS, the Helicopter Emergency Medicine Service, which is absolutely exhilarating, and they do the gnarly cases. But the healthcare system thrives on collaboration, so skills are definitely transferable between the two. If you want some help with getting into medicine, the Future Doc program helps people through the entire application journey so that they avoid confusion, avoid overwhelms, avoid mistakes, and maximize their application so it's the best it can possibly be. If you'd like to find out how you can get some help for that, you can apply to join the program by checking out this video here. However, if you're still not sure about what career to go for, check out the Future Doc YouTube channel where we can show you all of the comparisons between all the different healthcare careers to help you decide which one's right for you. Best of luck, and I'll see you in the next video.